Hi everyone, I'm Sam Ginsberg, a pelvic floor physical therapist in the Thomas Jefferson University Hospital System in Philadelphia, Pennsylvania. Today I'm here to discuss interstitial cystitis, also known as painful bladder syndrome in male patients or people with penises, through the scope of physical therapy. I must first clarify that sex and gender are two separate things entirely. Sex indicates the biological and physiological presentation of a person, whereas gender is a social construct. So to be clear, today I am discussing how painful bladder syndrome or interstitial cystitis impacts people with penises as compared to vaginas. I will be referring to sex going forward. Interstitial cystitis is more prevalent in female patients or people with vaginas. This has resulted in more literature, more research on that topic and that sex, lacking research for male patients. However, a study done in 2022 found that male patients with interstitial cystitis were diagnosed way sooner than their female counterparts. But regardless of when somebody is diagnosed, everyone with IC deserves to be treated with respect and deserves to be heard. So, as a PT, my expertise lies in the muscles, the bones, tendons, ligaments, and nerves, as well as function of the pelvis. So, many of the long-term symptoms of IC can be attributed to the pelvic floor, which everyone has. And so the pelvic floor has many different jobs, some of them including stability, pelvic stability. So that includes our ability to walk throughout the world. It also has the ability to hold up our organs. It has sexual functions and voiding functions, meaning our ability to pee and poo or not pee and poo. There's also a protective function of the pelvic floor, meaning when we're stressed or when we're in pain, the muscles of that area will tense up, get really tense. So, stress and pain tend to be a very common symptom presentation for people with IC, resulting in very tense muscles of the pelvic floor, making it hard to pee, making it hard to poo, making it hard to participate in sexual function. Men might find it hard to fully empty their bladders, their bowel, and to obtain and sustain an erection for sexual intercourse or masturbation purposes. Pain with ejaculation might also be present as that occurs through the urethra, a common area impacted by IC. Luckily, assessing and training the muscles of the pelvic floor can play a huge role in conjunction with medical treatment. I have a pelvic model with me today. It's a model with a penis. So we have our penis here, testicles, the torso would be up here and the head up here. The person's legs would be under here. So if I flip the model to face you this way, the red is our pelvic floor. Those are the muscles that I have been discussing, this red region here. The yellow are the nerves that go into the pelvic floor. They help us feel, they help us move. And if I flip the model this way, so looking from above, we can actually see the bladder, this organ right here, this pale organ. The bladder leads to the urethra, which leads through the penis and out of the tip of the penis. As you can see, these areas are very proximal or close to the pelvic floor. So things that are impacting the bladder will also impact the pelvic floor. I tell you all of this and show you all of this to say that there are many treatment options, regardless of your gender, regardless of your sex, for your pelvic floor and for people with IC. There are options out there. Physical therapy is one of them.